Hi, I'm Dr. Pao Vang, an ear, nose, and throat surgeon here at the Mayo Clinic Health System, and I'm here to address questions you may have about tonsillectomies. So tonsils are the part of the immune system, but they're located at the back of the throat, and they help prevent germs from getting into your body. They have a lot of white blood cells, and those white blood cells kills the germs that gets into your intestines, into your body. People have two tonsils that usually most people refer to tonsils are the one that you see at the back of the throat on either side. There is a third one called the lingual tonsil that sits behind, between the two of them at the back of your tongue. We generally don't touch that, but when patients have tonsillectomies, we remove both of those tonsils on either side of the throat that people usually see when they open their mouth. Tonsillectomy is the process of taking out the tonsils. We go through the mouth and we surgically take out the tonsils. A person would need tonsillectomy for three big reasons. One is recurrent sore throat or chronic sore throat. Recurrent sore throat is having sore throats over and over and over several times a year, or chronic tonsillitis is having a sore throat for 2-3 months that just will not go away. That would be an indication to remove your tonsils. The other indication is that the tonsils are so big that you're having sleep apnea. And when you're having sleep apnea from the big tonsils, then that's another indication to remove it. The third indication is usually when the tonsils are uneven. One is a lot bigger than the other. We want to rule out, make sure it's not a cancer, a throat cancer. And in that case, then we would recommend removing the tonsils. It is the second most common procedures that ENTs do. And the reason is because kids are growing up, they're constantly being challenged by bacterial and viruses, they're constantly having running nose. And that usually leads to a lot of tonsillitis. The other thing is that they tend to be smaller, the throat is a lot smaller, and they have big tonsils, and those big tonsils causes sleep apnea. That's also an indication to remove it. So it's a lot more common in kids than it is in adults. Adults also have tonsillectomies. They also have a lot of tonsillitis, but not as common as kids. And when they have a lot of tonsillitis, or they have large tonsils, or the uneven, tonsils, that's when we take out the tonsils in adults. When patients are getting a tonsillectomy, what I usually expect is I tell them to expect some pain. This is going to be a painful procedure. I tell them to take about a week off of work or a week off of school, stock up on fluid. There'll be no hard food, just lots and lots of soft food and drinks, and basically just focus on hydration for about a week. People do not stay in the hospital. In the good old days, we used to keep them in the hospital overnight. These days, we don't. The surgery takes roughly about 30 to 45 minutes. We keep the patient for roughly about an hour to 2 hours to make sure they're not sick to their stomach and they're not retching from the anesthetic. And if they're doing well, we let them go home, and almost everybody goes home. Some of the potential risk of tonsillectomy, the big one is basically bleeding. It's usually when patients are waking up from the operating room table and they're bucking and the blood pressure goes up. And if they have a bleed at that time, it's usually not a big deal because they're still in the operating room, we just stop it. The other is usually about 7 to 10 days later when the scab falls off. If you cut yourself, you have a scab, if it's on your arm, the air dries out, it looks black. In the throat after tonsillectomy, it looks white and frothy. That usually falls off in about 7 to 10 days, and that's when the risk of bleeding goes up a little bit. It's still very low. The literature quotes 0.2 to about 2%. So it's very low, but it is one that patients should know about and they should keep an eye on. The recovery is usually roughly about 2 weeks. What I tell patients is they're going to have pain for roughly about 1 week. And after 1 week, the pain will usually subside and slowly go away. After about 2 weeks, most people are back to normal. They may have pain when they yawn because they're stretching the surgical site, the surgical bed, and the throat is trying to heal up and close, and they're yawning, they're trying to stretch it. So they may experience some pain when they yawn. But other than that, most people are usually back to normal. To learn more, please click on one of the links on the screen or the description below.